Good afternoon. As Maria said, I'm Barb Cunningham, and my talk today is on the ACoS accredited cancer programs, both within the VA and compared to the non-VAs over a 10-year period. First, my disclaimer, I have no financial interests or relationship with manufacturers of commercial products, suppliers of commercial services, or commercial supporters. This presentation will not include any discussion of the unlabeled use of a product or products under investigational use. Now, many of you might recognize these faces and names of some famous people, but I'm wondering if you know what they may have in common with each other, as well with a little-known woman from the 1800s, Miss Sarah Newberry. Well, they all have died of multiple myeloma. Miss Sarah Newberry was one of the first documented cases of multiple myeloma in 1844. or multiple myeloma, has been around since ancient times, and evidence has been found in American Indian skeletons of the disease present. However, as I said, Sarah Newberry was among the first documented cases. When she was hospitalized in St. Thomas Hospital in London, 2 years after her symptoms had begun, she had many broken bones, her body was severely twisted, and she was in great pain. The doctors at that time gave her the very best available treatment. It included infusions of orange peels, rhubarb pills, and opium. To care for him who shall have borne the battle, and for his widow and his orphan. Famous words we know Abraham Lincoln spoke over 100 years ago, and words which our government still tries to live up to. In 1993, then Secretary of Veterans Affairs, Jesse Brown, announced that President Clinton had approved a decision to allow all Vietnam veterans who had been exposed to Agent Orange to be given compensation for respiratory cancers and multiple myeloma. And what this meant for our veteran patient, he no longer had to fight the system if he had served in Vietnam and developed any of these cancers to prove that it was related to his military service. A quick overview of what we're looking at today. There are 1,388 accredited cancer programs within the United States, having approximately 125,000 cases of myeloma during this time period. There are 132 VA hospitals. However, only 42% of those, or 56, have ACoS accredited cancer programs. There are 76 VAs which do not. The rest of this presentation is based on the data from the American College of Surgeons National Cancer Database, the NCDB. The NCDB is available for use by all accredited cancer program facilities. Throughout this presentation, the term all hospitals is going to be referring to the 1,388 accredited cancer programs that are not VA hospitals. The term VAMC will be used for the 56 accredited cancer programs within Veterans Administration. So once again, we're seeing over 125,000 cases of myeloma from the non-VA hospitals that are approved or accredited cancer programs, and from our 56 accredited cancer VA programs, we're going to be looking at 3,298 cases of myeloma. If the other VAs had been accredited, there would have been another 2,300 cases included in this study. The majority of the cases, over 90%, are multiple myeloma, with less than 8% consisting of plasmacytoma. And as you probably all know, multiple myeloma is a much more systemic disease affecting many areas of the body, while a plasmacytoma may affect merely even one bone or one specific area. Quick look at the number of new cases during this time period of myeloma shows us that less than 2% of all cases within both the VA and the non-VA are multiple myeloma. And the numbers are pretty similar, all of them showing less than 2%. Multiple myeloma, however, does compose 10% of all hematologic cancers diagnosed on a yearly basis. And I'll take a look at the race, both at the Veterans Administration Center and at all hospitals. We do see the majority of patients are white in both facilities. However, the black man or woman is twice as likely to acquire multiple myeloma than is the white patient. However, as you see, the numbers are greatly different, and we have many more whites than blacks with multiple myeloma, but keep in mind that the United States population is only 15% black Americans. If there is a major risk factor, it can be considered age. As a person ages, it appears that his susceptibility to multiple myeloma increases. Over 95% of our patients are older than 45 years of age, and the vast majority are older than 65. Per SEER, the median age range to develop myeloma is 69 years of age. One of the biggest differences seen among our veteran patient and our non-VA patient is the distance he must travel to receive treatment for his disease. The non-VA patient, there are 21% of those patients who are able to receive treatment for their disease within 10 miles or less of where they live, while within the VA, only 8% have that ability. Within the VA, there are over 35% of the MM patients who must travel 100 miles or more to receive treatment, while in the private sector, only 8% need to travel that distance. Well, treatment since 1844 has certainly changed greatly. The treatment today is to prolong the quality of life and stop the progression of the disease. Sometimes when multiple myeloma is diagnosed at a very early stage, the patient will not need treatment, but must be watched very closely by his physician. Within the VA and other hospitals, it is a multimodality treatment given. It includes endocrine therapy, chemotherapy, hormone therapy, immunotherapy, stem cell transplantations, and radiation and surgery, sometimes to particular bone areas. While the treatment at the VA shows more patients not receiving a first course treatment than in the private institutions, one of the reasons is probably because of the type of patient we see. Many of our ex-soldiers are very stoic and simply refuse to go to see a doctor until their pain becomes so debilitating that they can barely do daily functions. And at times when they do go at that point, they are beyond receiving treatment and are entered into palliative care systems. I would like to thank you all for your attention, and that's my topic. Thank you.